Nizam, I have shared you link for the live streaming. Please share in the group.
Screen is visible, no, Dr. Shraddha?
Yes, sir, it is visible.
Okay.
Dr. Nizam, if everything working properly, then we can start now. So we can start.
Okay. It's not in full screen mode, no?
The screen is visible. You can go by slideshow method.
Is it okay?
Yeah, it is visible, but there
Is
is
it full screen or?
no, it's not full screen. Yeah, you just click on.
Now it is okay?
Still, it is not
Dr.
showing.
Deepali, please guide, sir.
Sir, please click on the slideshow again.
It is not operating from my end.
Sir, we can also operate from tab panel. There is animation की साइड में ही है.
Is it okay?
Is it not? Sir, ऊपर. Oh, yes, it's right now.
It's okay?
Yes.
Yes, sir. Now okay.
Shall we start?
Yes, sir, we can
Yes,
start.
sir.
So very good evening to one and all. Welcome to today's discussion on male infertility. So I'll be putting you the entire dimensions of male infertility, but the time may not be permitted for covering entire perspective of male infertility. So I'll be giving you here and there and examination part and few of the diagnostic tool and semen analysis, and followed by Ayurvedic treatments. And I'll discuss two cases which are very burning issues when we start making our clinical practices, when we focus on managing the male infertility with respect to uh, entire what we call it as a IVF or ICSI or so many modern diagnostic dimensions. So when we get a patients of male infertility, uh, they have opted many varieties of treatments across many higher centers, and later they turn out to Ayurvedic treatment. देख लेते हैं एक उधर क्या हो जाता है, एक ट्रायल तो ले लेते हैं आयुर्वेद में कि अच्छा रिजल्ट मिलता है कि नहीं मिलता है. So when such challenges come across in your practices, you need to be very conscious and cautious about analyzing the patient more appropriately. More pinpointed diagnosis is required from Ayurvedic perspective as well as from the modern perspective also. So coming to the next direct topic. Uh, just a minute. ನಾಳೆ ಬಂದ್ಬಿಡ್ರಿ. ನಾಳೆ ಬಂದ್ಬಿಡ್ರಿ. I'm in class. Am I audible? Dr. Nizam, am I audible?
Yes, sir. Yes, sir. Audible.
So understanding infertility. So coming to the what exactly this infertility is called as. So we have two basic benches to understand the infertility: the 12 months of time and the 6 months of time. So as the 30 years of male inability to achieve pregnancy after 12 months or more than that with a regular unprotected sexual intercourse could not able to get conceived, then we can consider them under the category of male infertility. Or if a male is more than the age of 30 or 35 years, that time period will be reduced to from 12 months to 6 months. So the term, this particular term, that is men who can't get a woman pregnant and woman can't get pregnant or carry a pregnancy, and this particular term is called as male infertility. So the 12 months time and the 6 months time are the very crucial time as per the WHO standards, with the age limit along with a time period of regular unprotected. So global prevalence, when we make a survey of different research articles, so we get this particular data that the global prevalence is 9% of men and about 11% of women of reproductive age in a global prevalence has experiencing infertility or some or the other fertility issues. 9% of men and 11% of women are experiencing this. There are many etiological factors, and both male and female are contributing 50% of etiological factors. How much women are responsible for infertility, the same men are also responsible for that. So ये बहुत मुश्किल होता है कि जब भी पेशेंट हमारे ओपीडी में आते हैं तो ज़्यादातर स्त्रियां आते हैं, वुमेन आते हैं कंसल्टेशन करने के लिए, उनके घर वाले या उनकी कोई भी ससुराल वाले या इस तरफ उस तरफ कोई भी लेकर आते हैं, तो विदाउट हस्बैंड दे कम. तो हमारा उद्देश्य ये होना चाहिए कि दोनों को इस चीज को उनको समझाना चाहिए कि infertility is not a single hand clap. So when you want to clap, both hands are required. So how much responsible women is, similarly the same amount of responsibility is also there with men. So that is why when a women are brought for to have a kid or children or offsprings into your OPD, it's very, very important that you should make them to understand the importance of bringing their husband. And the first and foremost thing what you need to do is couple counseling. So when you do a couple counseling, it is must and should that both the couples should be there in front of you in your cabin or in your consultation room, and you need to make them to give a good atmosphere, and they have to make a belief on you. You have to make them comfortable, take them into your confidence. Then you have to proceed with the history taking, then you have to go for examination, then you have to make a fine diagnosis and where exactly problem is, it is in a male or a female. So then you can focus on a certain line of treatments. Otherwise it is not possible to have a complete approach in the management of infertility. So in overview, global prevalence is 15% of couples are affected. Under the male factor, 40 to 50% of cases of male factor is found, and major impact is the social, the emotional, and of course, when they go for a consultation with available other contemporary medical sciences, the financial burden is very high. So we have to take into account of all these things. You have to make them to understand सत्वावजय चिकित्सा बहुत important है. So emotional imbalance is there in both the couples. तो पहले उनको सांत्वन देना है, काउंसलिंग देना है, उनको समाधान देने के बाद whatever the things which are happened, अभी आगे क्या करना है. So ये सब चीजें उनको बता के उनको अपने कॉन्फिडेंस में लेना है. जब तक पेशेंट वैद्यवश नहीं होता है तब तक आपको स्पेशली इनफर्टिलिटी में चिकित्सा देना बहुत मुश्किल होता है. So inability to conceive after 12 months of unprotected intercourse with a regular intercourse, then the couples could not able to conceive, then we can label them as an infertile couple. Then you have to go for an evaluation. What are the exactly management in a male infertility? It is estimated that around 1 in 7 couples who are suffering from infertility affects, then 50% cases contribute to the male infertility, and the current therapeutic interventions in the contemporary medical science is ICSI, or they will go for a ART, or they will go for a some or the other IVF or something else. So it's very, very important that a physician or a person who wants to practice in the field of infertility, they should know all these domains and dimensions. So sperm functional assessment, where you need to go for a semen analysis. And if you have a high-end laboratories, you can go for a CASA, that is computer-assisted semen analysis, or sperm DNA fragmentation test. And there are certain standard methods are there to follow in the treatment of ICSIs. So new developments are also there. That is not our domain. We are not going into all those points where Emzome is there, ICSI is there, HOS is there. So all those things we are not going to that because that is not our domain of discussion today. So genetical testings are also there. Karyotyping you can go for Y chromosomes, or if you go for a chromosome testings, Y deletions are there, single strand, double strand, so many things are there. So CFTR analysis is also very, very important. That cystic fibrosis, transmembrane conductase regulators, mutations analysis are important because of recurrent abortions are also there. So when a patient or a couple comes to OPD, when they give you the history of recurrent abortions, you need to go for all these investigations. So what could be the reasons? The blockage of the spermato or sperm transport systems, and this blockages happens because of reasons that I have mentioned over here, like the infections or the recurrent infections of the urinary systems or the genitourinary system, prostatic complaints or the diseases pertaining to prostate glands, then absence of vas deferens, then surgical history of vasectomy, or possibility of or there may be other any pelvic floor surgical interventions, or maybe the Ksharasutra Chikitsa. And when you go for an anti-sperm antibody analysis, you may find out ASA is positive, or sometimes there is a surgical history of a hernia, then epididymal infections are there, cysts are there, or any of the orchitis are there. So any of the hydrocele may be there, operated hydrocele may be there, and some of the etiological factors which we could not able to ascertain during our history taking, as patient is not giving you the entire history. Then coming to the hormonal issues, pituitary tumors are there, then congenital lack of LH and FSH hormones, then andropause or low testosterone levels, which is burning issue nowadays. So that might be one of the reasons for hormonal issues. Then coming to the lifestyle factors, which are very, very important from the perspective of Ayurveda, where we need to, we are the only one who can provide correcting their lifestyles. आहार विहार मानस, ये चीजें हमारे अंदर ही आयुर्वेद है. दिस इज द वन ऑफ द एरिया फ्रॉम पर्सपेक्टिव ऑफ आयुर्वेद. आयुर्वेद में ही हम आहार विहार का पूरा संतुलन, आहार पूरा विहार कैसा करना है, क्या क्या व्यायाम करना है, क्या योगा करना है, कौन सा एक्सरसाइज करना है, कब करना है, कैसे करना है, everything is there in the documented books of Ayurveda. In all the Brihatrayas and Laghutrayas, you will get much more detailed explanations related to संतर्पणोत्थ व्याधि और अपतर्पणोत्थ व्याधि. स्थूल देही रहते हैं लेकिन उनमें से फर्टिलिटी इंडेक्स कम रहता है, अच्छा शरीर रहता है फिर भी उनमें इनफर्टिलिटी का इश्यूज रहते हैं. सो ये सब चीज़ों को जुड़ के एक अच्छा सा एक एसओपी बनाना है. तो उस एसओपी में लाइफस्टाइल डिसऑर्डर्स को किस तरह से एड्रेस करना है उसका भी हमें एसओपी बना के उस तरह से हमें सब लोगों को, या जो भी इनफर्टिलिटी पेशेंट्स आपके ओपीडी अंदर आते हैं तो उन सबको बोलने का हमें उसको एक रेडी रेकनर देना है. सो पुअर डाइट एंड लाइफस्टाइल, stressful activities maybe in the works or maybe in the home or in the environment where they are living. Then the sleep patterns nowadays, akala bhojana, akala shayana, so late night sleeping and taking food very lately. So akala bhojana, akala shayana, it's very, very important etiological factor which vitiates the samana vata and agni. So when we focus on samana vata, when you go to Ashtanga Hridaya, Ashtanga Sangraha, Sutrasthana, the Samanavata functions are little bit more elaborated. Most of the time we focus on Samanavata. Samanavata के function के ऊपर हम जब focus करेंगे, श्लोका एक दो श्लोका तो बता देंगे. समानो अग्नि समीपस्थः कोष्ठे चरति सर्वतः, वो श्लोका तो हम बता देंगे, लेकिन उसका आगे चलकर अष्टांग संग्रह में आपको और भी कुछ विषय मिलते हैं. तो समानवात अग्नि के साथ रहते हुए कौन से स्रोतों को वो कंट्रोल करता है? दोष, शुक्र, अम्ब, अंबु, आर्तवोह स्रोतो विचारी. सो समानवात सिर्फ जीआईटी को ही कंट्रोल नहीं करता है, वो शुक्रवह स्रोतोस को, वो आर्तवह स्रोतोस को, अंबुवह स्रोतोस को, दोषवह को भी रेगुलेट करता है. तो जब भी हमारे पास पेशेंट इनफर्टिलिटी के आते हैं, वो शायद मेल हो या फीमेल हो, कोई भी हो, तो जब तक हम अग्नि और समानवात के ऊपर चिकित्सा नहीं करेंगे तब तक हमें चिकित्सा का पूर्ण लाभ नहीं मिलता है. Many times I have seen many experts, physicians who are practicing infertility, many students, postgraduate, undergraduate, or our own colleagues. Whenever a patient comes to OPD with a history of infertility, so most of the time they consider, because it is shukra dhatu, shukra ejaculation होने के लिए या उसके लिए अपानवात ही चाहिए, आर्तव प्रवृत्ति होने के लिए अपानवात ही चाहिए. बहुत सारी चीजें हैं, सिर्फ अपानवात से ही नहीं होता है. अपानवात का काम है सिर्फ जो भी हमारे शरीर के लिए मलरूपी द्रव्य रहते हैं, मलरूपी वस्तु रहते हैं, उनको शरीर से बाहर निकालना, निष्क्रमण करना ही सिर्फ अपानवात का काम है. उससे पहले जो भी काम होता है वो समानवात से होता है. तो हमारा चिकित्सा सिद्धांत समानवात को ठीक करने की कोशिश होनी चाहिए. जब तक हम समानवात का चिकित्सा ठीक से नहीं करेंगे, जब तक हम अग्नि का चिकित्सा ठीक से नहीं करेंगे, जब तक हम उसका लाइफस्टाइल एंड फूड एंड लाइफस्टाइल पैटर्न्स को, इस इश्यू को या मेल इनफर्टिलिटी या फीमेल इनफर्टिलिटी को हम ठीक नहीं कर सकते. तो इसलिए फूड पैटर्न्स, lifestyle patterns, stress patterns and sleep patterns, everything affects the production of the sperm. Everything affects the ovulation. So that is why both the spermatogenesis and ovulation, both are absolutely depending on the Agni and Samanavat. Even the maturation of the spermatozoas is also depending on the Samanavat. Samanu अन्नम गृह्णाति पचति विवेचयति मुंचति। अन्नम गृह्णाति, न्यूट्रिशन को अंदर लेना, उसको मेटाबॉलिकली ट्रांसफॉर्मेशन करना, उसको सेग्रीगेशन करना कि जो चीजें शरीर को चाहिए उसको, शरीर का पोषकांश को अंदर लेना, और जो नहीं चाहिए उसको शरीर से बाहर डालने के लिए अपानवात को लगाना काम के लिए। ये सभी चीजें समानवात का काम है। तो जब समानवात का फंक्शन और अग्नि फंक्शन आप रिप्रोडक्टिव सिस्टम के ऊपर स्पेसिफिक लगाओगे तो स्पर्मेटोजेनेसिस पूरा का पूरा काम अग्नि और समानवात से ही होता है। तो जब तक हम स्पर्मेटोजेनेसिस या ओव्यूलेशन और एग प्रोडक्शन और डोमिनेंट फॉलिकल रिलीज, ये सभी चीजें जब तक आप अग्नि और समानवात को एड्रेस नहीं करोगे तब तक के लिए ये इशू ठीक होने वाला नहीं है। Next, other issues. Patient is coming to your OPD with a lot of issues related to recurrent urinary tract infection. Patient comes to your OPD with premature ejaculation. So sometimes patient gives you a history of retrograde ejaculation. Patient does not give you the history of retrograde ejaculation. Patient बोलता है कि डॉक्टर साहब, after going for intercourse, when I go for urination, I pass semen. So why it is so? Because the semen is not coming completely outside, but some portion of semen is going inside the bladder. So if you want to diagnose such retrograde ejaculation, RGE, retrograde ejaculation, so you can go for post-coital urine analysis. उसमें से आपको स्पर्मेटोजोआ मिल जाएंगे, तो उससे आपको डायग्नोस कर सकते हैं कि रेट्रोग्रेड इजैकुलेशन हो रहा है। तो उसको आप एक उत्तरवस्ती देंगे तो रेट्रोग्रेड इजैकुलेशन ठीक हो जाएगा, एक अनुलोमन चिकित्सा करेंगे तो ठीक हो जाएगा, एक विरेचन देंगे तो ठीक हो जाएगा। तो उसके लिए ज़्यादा चिकित्सा देने की जरूरत नहीं है, पेशेंट अपने आप जल्दी जल्दी कंसीव हो जाएगा। सो फेलियर टू इजैकुलेट, पवनेन्द्रियाः, so Sushruta, if you go to Sushruta, Pavanendriya, after so much of, it is called late ejaculation. Some patient comes to you with a history of early ejaculation, premature ejaculation. Sometimes patient comes to you with late ejaculation. So failure of ejaculation after doing so much of intercourse for 5 minutes or 10 minutes could not able to ejaculate. The erection is also reduced, but the patient could not able to ejaculate. Some sort of obstructive pathology may be there, some sort of hormonal issues are there. So that's why these are all things which you need to take history when your patient comes and sits in front of you. So infrequent intercourses. The patient is not habitually involved in regular intercourses. That is also one of the cause for the infertility. Then spinal cord injury, history of fall, उसका कमर के लिए या कहीं पर गिर जाते हैं तो उनको कुछ इंजरी हो जाता है, मर्माघात हो जाता है, या कोई भी सर्जिकल इंटरवेंशन करते हैं, स्पाइनल कॉर्ड इंजरी और लंबर लैमिनेक्टमी हो सकता है, डिस्केक्टमी हो सकता है, तो दे आर आल्सो contributing factors for the male infertility. Then prostate surgical interventions, so TURP or truss or any of the prostatic surgery or outside. So they are also these are the causative factors which damage the spermatozoa or its DNA composition. Then varicoceles or some of the causes which are unexplained. Then varicoceles or some of the causes which are unexplained or unknown causative factors are also there. So these are the common basic causes which you can divide under the heading of pre-testicular, testicular, and post-testicular. So endocrine, psychosexual, drug-induced, genetic components comes under the pre-testicular causes, because from hypothalamo-pituitary, gonadal axis or testicular axis, what is there till testis, it is called as pre-testicular. And inside the testis, what are the causative factors that you can understand with the immotile cilia, it's called as a Gardner syndrome, then cryptoorganism or archaidism, then infections or the history of viral infections in the childhood or mumps or any of the viral infections can also cause the arrest or reduce the spermatogenesis. And the drug-induced smoking, tobacco, all those things can also be understood as a toxins, which also produces the low count or motility disturbances or morphological or count or any of the abnormalities in the semen analysis. Then immunological, then Sertoli cell syndromes are also there. Primary testicular failures where spermatogenesis is not happening. Then comes with the OAT syndrome, oligoasthenoteratozoospermia, OAT syndrome. It is called as a OATS. So that all comes under the group of testicular causative factors. And post-testicular obstruction in the efferent ducts. Sometimes there is an absence of vas difference, Young syndrome, then acquired infections, maybe tuberculosis or sexual transmitted diseases or pelvic inflammatory diseases can also produce the post-testicular obstruction, where you may get a patient with obstructive causes can also produce the azoospermia. Then surgical interventions, then herniorrhaphy or vasectomy can also cause the post-testicular causative factors. Then others, ejaculatory failure, retrograde ejaculation, hypospadiasis, then bladder neck surgeries. That these are the causative factors which are considered as a post-testicular etiological factors for the male infertility. So what are the basic signs of male infertility? So usually when you analyze the complete patient in your OPD, low ejaculation or the volume of the semen is very less than 1.5 or 2 ml, and premature or the retrograde ejaculation will be there. Then struggles with low erection, possibility of low testosterone or chlamydia or any of the other reasons may be there. Loss of libido, so desire disorders, it comes under the desire disorder, loss of libido. Desire is not there. बहुत सारे पेशेंट जब हम काउंसलिंग में बैठते हैं, कपल काउंसलिंग, फीमेल पार्टनर बोलते हैं सर उनको कभी मेरे पास आने के लिए डिजायर ही नहीं होता है, तो इंटरकोर्स करने के लिए उनका मूड ही नहीं रहता है, हमेशा टेंशन में आप खोए खोए रहते हैं, कुछ सोचते रहते हैं, उनको कभी भी इंटरकोर्स करने की मन ही नहीं लगता है. So loss of libido will be there, or loss of desire disorders will be there. Then pain and swelling in the testis because of the injuries or some or the other inflammatory pathologies. Then hormonal imbalance. All these things can be considered as a signs of male infertility. Sexual characterizations. This is very, very important. So when you go for a patient for examination purpose of male, so you have to think of all these sexual characterizations. So secondary sexual characteristics were developed or not. So chromosomal sex, gonadal sex, hormonal sex, phenotypic sex, psychosexual identity, legal or assigned sex. जैसे हमारे यहाँ बोलते हैं ना कि मातृ पितृज, माता मातृज, पितृज, सत्वज, सात्मज, आत्मज, आहारज, रसज. All these are the properties which help for प्रकृति को निर्माण करने के लिए. वैसे ही same things are also there in other contemporary medical reproductive science, where they have identified chromosomal sex, matraja, pitraja, gonadal sex, hormonal sex. So everything is documented, what is exactly explained by our acharyas. So based on sex chromosomes, based on gonadal types, then based on predominant sex hormones from the hormonal sexual, then phenotypic sex, external genitalia were developed, second sexual characters were developed or not, penis, scrotum, vulva or breast. So when example, what are the examination things you have to do when a sexual characteristics need to be identified? Then phenotypic sexuals, then psychosexual identification, self perception of gender. So हमें बहुत सारे टाइम पे यही मुश्किल आता है कि है तो वो मेल लेकिन they start behaving like female, or there is some sort of difficulty in their expression of their own complaint, walking style, even their voice, so many things, or gynecomastia, or underdeveloped testes, or sometimes there is a hair distribution on the different parts of the bodies, or in the chest, or in the pubic region where very low. So all those things can be identified on this particular domain. Then assigned sex. There's assigned sex is nothing but the transmigration of the genders. So such patients are also coming to your OPD. So all these things you need to identify for understanding the characteristic properties of developed sexual, secondary sexual characters. Then diagnostic tools for these sexual characteristics. Then karyotyping you have to go for, where you are going to make a determination of the chromosomal patterns. Uh, then ultrasound USG of pelvis or MRI pelvis, where identifies internal reproductive organs were developed or not. Hormonal assays, FSH, LH, testosterone, estrogen levels need to be. DHEs, all those things are comes under the group of hormonal assays. Then physical examination to assess secondary sexual characteristics. Then genetic testing for disorders like Survey syndrome, mutations, or VSD, all those things need to be understood under these particular diagnostic tools. And common conditions requiring sexual characterizations. So androgen insensitivity syndrome, where X and Y karyotypes, then female phenotypes are can be identified. KF syndrome or Klinefelter's syndrome, where 47 chromosomes with XXY male infertility is identified under KF syndrome. Turner syndrome, where X female with gonadal dysgenesis. Then congenital adrenal hyperplasia. So XX individuals with virilizations, all these things can be understood under the common conditions requiring sexual characterization. So when you go to Charaka Samhita, the Vajikarana Chikitsa, Acharya Charaka has explained sexual characterization from Ayurvedic perspective. So how you can understand this particular shloka? Nahi jata balaha sarve narascha apatya bhaginaha. So beautifully Acharya Charaka has explained. Nahi jata balaha sarve. All are not endowed, all are not blessed with apatyas. All are not blessed with apatyas. We all are doing apatya, that is why we are suffering from apatya rogas. So लाइफस्टाइल डिसऑर्डर्स में जब हम अपथ्य ज्यादा करते हैं तो अपत्य रोग ज्यादा आ जाते हैं. So apatya means irregular food habits or faulty food habits and lifestyles. Then apatya means santana. So all are not endowed or blessed with to have offsprings or children. So that's very, very important to keep ourselves more fertile, to have our next generation to be endowed with good fertility. That is why Charaka also further says that once a person who undergoes the process of Shodhana, followed by Rasayana, followed by Vajikarana, what is going to benefit to a person who undergoes all these three segments of treatment? The three generations of the person who undergoes for such treatment, the three generations, their three generation genetic integrity is maintained. Were protected. So that is why Shodhana, followed by Rasayana, followed by Vajikarana. What it does, it makes a cytoprotective and genoprotective. It protects our gene for three generations. So there is no genetic mutations, genetical disorders can be absolutely prevented by undergoing with one Shodhana, appropriate Shodhana for that particular person, and followed by one Rasayana Chikitsa, followed by Vajikarana Chikitsa, which absolutely protect the entire Saptadhatus, especially Shukra Dhatu, that which helps for further formation of Garbha. So whatever the genetical disorders which are carried from their parents to offsprings, that can be checked or stopped at the level of during the formation of Garbha. So that is very, very important. Once those couples who want to undergo for conception, the first and foremost thing as a clinician, you all have to make them to understand couple counseling, make them to understand the importance of Shodhana, Rasayana, followed by Vajikarana. So these treatments are mandatory for everyone, those who want to have a children. So first you go for one Shodhana, appropriate Shodhana for that particular person, which is Yogya. You have to check it. Accordingly, you have to suggest the one Shodhana, followed by one Rasayana, followed by one best Vajikarana Chikitsa. Then they can go for natural conception. So even even for fertile couples also, you have to advise all these things. So not only for infertility, even for fertile people, those who want to have a children, Garbhadhana Samskara, what we advise. So in that component, this comes. So nahi jata balaha sarve narascha apatya bhaginaha. Further Charaka says, Brihat Sharira Balinaha Santi Narishu Dubbalaha. A person is very stout, very healthy, and very six-pack person. Brihat Shariraha Balinaha. A person is very strong and his strength and stamina and endurance and virility, everything is fine. तो बहुत अच्छे हैं, उसमें कोई भी कमियां नहीं है. बृहत शरीरा, अच्छे हैं, संतुष्ट है. All his BMI, weight, height, everything is fantastic. But Nari Ishu Durbala. When it comes for intercourse, when it comes for conception, he is Durbala. So that is a one type of sexual characterization that you have to identify when you take a history of a patient. Next, second line. Santicha alpa ashrayaha strishu balavanto bahu prajaha. See the beauty. Alpa ashrayaha. Alpa ashrayaha means very thin, very lean. उसको देखे तो लगता है कि इसको कैसे बच्चे हो जाएंगे, ये तो बहुत लीन है, इसमें तो कोई रस भी नहीं है, शुक्र भी नहीं है, ऐसा लगता है. लेकिन स्त्रीषु बलवंतो, such persons are very having very good virility, very good stamina, strength and good erection. Not only that, last word, you just focus on the last word, bahu prajaha, they are having multiple progenies. So having children, having more number of children is not directly related with the height and weight and BMI of a person. It is absolutely related with some other domains. That's why it's very important that those who are having very good scout and very good personality physically, we cannot label them as they are very fertile. So fertility does not depend on Brihat Sharira or Alpashraya. It depends on other factors. Next he says, third line, Prakritya cha avala santi santi cha ayam durbalaha, amaya durbalaha, amaya durbalaha, Prakritya cha avala. Naturally, they are not having that much of strength and stability, strength and virility. Some of them are amaya durbalaha, because of suffering from chronic diseases. Their fertility index is reduced. Naraha chatakavat kechit vrajanti bahushaha striyam. Further he says how the frequency of intercourse is there. He has compared with the chatakavat. Naraha chatakavat kechit. Some of them are having chatakavat intercourse because vrajanti bahushaha striyam. So they are involved in multiple settings of intercourse. The frequency is more, but the quantity of semen is very less. So this you have to identify. Then gajavacha prasanchanti. So ejaculation is more. Prasanchanti means ejaculation. Wow. Gajavat prasanchanti. So gaja ejaculates more amount of, huge amount of semen. Kechit bahugaminaha. Kechit na bahugaminaha. So gaja ejaculates more. Similarly, some persons who ejaculate more amount of semen, which is more than 4 ml or 5 ml, but na bahugaminaha, the frequency is less. They may involve intercourse for one time a day or once in a week or twice in a week. Why this is very important? When you make a couple counseling, the mid of the day, when you go for a follicular analysis, there comes this particular concept to apply. So you advise the patient to go for intercourse 2 to 3 times a day on the mid of the cycle, on 12th day, 13th day, 14th day, 15th day, or 16th day, mid of the cycle, where ovulation happens, dominant follicle releases. In such clinical condition, you ask the couples to get involved more number of times for intercourse. So chatakavat frequency is more, but the quantity of semen is very less. So possibility of conception is disturbed. But gajavacha prasanchanti, volume, but frequency is less. So what to address, what type of treatment need to be given in such clinical condition? So you have to give shukra vardhaka chikitsa where, bala vardhana chikitsa where. So both are entirely different perspective of application. Next further he says, kala yoga balaha kechit. Some of the person are having kala. There are some varieties of kalas which they explain. Shita kala, ushna kala, adhana kala, visarga kala. So many things have been expressed kala yogas. So kala and yoga bala, daivava yoga bala, right? Naturally they are bestowed with having good strength and stamina, and because of the particular kala or because of the ovulatory period or because of the particular kala or because of the ovulatory period or because of the person is having those with a variety of strength and stamina. Kechit abhyasana dhruvaha. Kechit abhyasana dhruvaha. Abhyasana dhruva means आप बार बार एक ही सब्जेक्ट को 10 बार पढ़ोगे तो डेफिनेटली इट विल हेल्प टू अंडरस्टैंड। उसी तरह जो बार बार रेगुलरली इंटरकोर्स करता रहता है उनको एक प्रैक्टिस हो जाता है, आप तो अपने आप स्टेबिलिटी बन जाता है, स्टेबल हो जाता है, तो their performance will increase, their erection will increase, will also come to know when to get conceived or when not. So that is why abhyasa is also very very important. It is not only in study, here also in Vajayanana abhyasa is very very important. केचित् प्रयत्नैः विज्यन्ते वृषाः केचित् स्वभावतः केचित् प्रयत्नैः विज्यन्ते. So some of them are improving their fertility by involving in continuous प्रयत्न. So बार बार प्रयत्न करने से वो सफल हो जाएंगे. So वृषाः, so they become more fertile. केचित् स्वभावतः, some of them are having naturally they are having swabhavatah by kapaja prakriti or shukrasara purushas. Swabhavatah they are having very good strength and stamina and virility. So sexual characterization, all this is the same thing which I have just translated into English. Next is grouping of the etiological factors for the understanding of male infertility. Manasika bhavas are there, shukra kshaya lakshanas are there, ati maithuna janya vata prakopa or shukra kshayas are there, then vegavarodhajanya rogas are there. Then some of the asadhya clinical conditions are also there. Medra rogas, any trauma or any injury to the medra pradesha or vrishna pradesha, marmachedana, or any of the surgical interventions which we have discussed in the earlier slides, or some of them are sahaja bhavas, or undescended testes, or testicular atrophy. So all those comes under the group of asadhya avastha. So dimensions of definitions. So who to be called as infertility? Infertile couples or infertile men. Inability of a couple to conceive within 1 year of unprotected regular intercourse is called as infertility. Who to be called as a sterile? This implies an intrinsic inability to achieve the pregnancy, even though everything is fine, but they could not able to conceive. So that comes under the group of sterility. And primary infertility applies to both who have not conceived yet for 1 year or 6 months above the age of 30 or 35 years. So secondary infertility, whom they have got conceived, they are having one kid or two second, then they are trying for a second one, they could not able to conceive or they could not able to get conceived with all other precautions. So that is why that is called as secondary infertility. So designates those who have conceived at some time in their past life for 1 year, 2 years, 3 years, 5 years, 10 years down the line, but they could not able to conceive after 2 years continuously they are trying for conception, they could not able to conceive. So such category was considered as a secondary infertility. Factors essential for conceptions. So healthy spermatozoa should be deposited high up in the vagina or near to the cervix. This is very very crucial and very very important from the perspective of normal conception. So many a time couples comes, we have got a very good erection sir, we have tried our level best, हम आपने जो भी गाइडेंस दिया था उसी में हमने सब कुछ किया है सर, फिर भी हमें कंसीव नहीं हो रहे, तो अभी क्या करना है? ऐसे पूछ के आते हैं तो उनको समझाना है कि जब आप इंटरकोर्स करते हो तो आपका इजैकुलेशन होते समय आपका सीमेन वजाइना से क्रॉस करके सर्विक्स के समीप डिपॉजिट होना है, सर्विक्स के नजदीक डिपॉजिट होना है. सो डिपॉजिशन ऑफ सीमेन शुड बी इन द हाई अप इन द वजाइना और नियरर टू द सर्विक्स. दिस इज वेरी वेरी इंपॉर्टेंट. दिस हैज टू बी मेड understood. This has to be made, the couple has to understand all these things. You have to make counseling. So if it is not happening, and what are the other measures you can advise them? So after intercourse you ask the couples को बोलना है कि अपनी वाइफ को बोलना या उनको बोलना है कि आप एक 15 मिनट आधा घंटा उठना नहीं है और वजाइना थोड़ा ऊपर होना है, तो बैक में आपको लोअर बैक में एक पिलो रख के सोना है एक 10-15 मिनट पोस्ट इजैकुलेशन, पोस्ट इंटरकोर्स, ऐसा बोलना है. या जब भी उसको इजैकुलेशन होता है ऐसा उसको मेल पार्टनर को लगता है तो थोड़ा अंदर से ठीक से दबा के रखना है टिल कंप्लीट इजैकुलेशन गेट्स ओवर. ये सभी छोटे छोटे चीजें रहते हैं. कभी कभी सुनने के लिए क्लास में हम ये सब बोलते हैं तो बच्चे हंसना शुरू करते हैं. जब कंसीव नहीं होता है तो बाद में वही बच्चे जब शादी होते हैं तो हमारे ओपीडी में आते हैं तो बोलते हैं सर आपने ऐसा बोला था, हम कोशिश कर रहे हैं, नहीं हो रहा है। तो ऐसे चीजें होती हैं, आपको पेशेंट को समाधान से उनको बोल और ये सब चीजें को धीरे धीरे बोल के उसको ठीक कर दिया। तो क्योंकि सभी पैरामीटर्स नॉर्मल रहते हैं फिर भी दे कुड नॉट एबल टू कंसीव। सो दवा लेने से अच्छा है कि आप सत्वावयव चिकित्सा करो, उसका कपल काउंसलिंग करो, कैसे इंटरकोर्स करना है, कैसे करना है, क्या करना है, कब होना है, कैसे होना है, ये सभी छोटे छोटे चीजें रहती हैं, उसे भी आप समझाओगे तो अच्छा आराम से नॉर्मल से कंसीव हो जाएंगे। The sperm will undergo changes, that is capacitation of acrosome reactions, then acquire motility. These are the cervical factors. तो क्या होता है सर्वाइकल में म्यूकस, आपको सर्वाइकल में जब इंटरकोर्स होता है तो म्यूकस सिक्रेशन होता है, तो इसलिए हम सर्वाइकल म्यूकस प्लग को लेके टेस्ट के लिए भेजते हैं। तो व्हाट इज द रिएक्शन ऑफ दिस म्यूकस which is in the cervix area, cervical region, which is not allowing the spermatozoas or semen to enter inside the cervical canal. So if it gets rejected, then the semen or the spermatozoas could not travel inside the cervical canal. So this is very, very important test you need to carry out. So the motile spermatozoa should ascend through the cervix into the uterine cavity and the fallopian tube. तो ये भी इम्पोर्टेंट है। और एक चीज आपको बताऊंगा, जब इंटरकोर्स होता है, जब इजैकुलेशन होता है तो स्पर्मेटोजोआ ट्रैवल करने की कोशिश करते हैं। तो ट्रैवल करने की कोशिश करते समय ये चीज आप देख रहे हैं नीचे, एंडोमेट्रियल पेरिस्टालसिस। सो पेरिस्टाल्टिक मूवमेंट हमारे समझ में ये आता है कि पेरिस्टाल्टिक मूवमेंट सिर्फ इंटेस्टाइन्स में होते हैं, ऐसा नहीं होता है। पेरिस्टाल्टिक मूवमेंट्स आर आल्सो देयर इन एंडोमेट्रियम। सो एंडोमेट्रियम जब उसका मिड ऑफ द साइकिल आते रहता है तो वो उसका मूवमेंट टू सर्विक्स होता है। जब उसका 20 डेज के ऊपर 21 डेज के ऊपर होता है तो उसका मूवमेंट एंडोमेट्रियल मूवमेंट कैसा रहता है, सर्विक्स टू फंडस होता है। तो इसलिए वेरी वेरी इंपॉर्टेंट है कि जब मूवमेंट जब रहता है तब उसको कंसीव करने की कोशिश होना चाहिए। तो जब मूवमेंट सर्विक्स टू फंडस होता है 20 दिन तक या पोस्ट मेंस्ट्रुअल डे टू 5th डे टू 20th डे, मूवमेंट विल बी देयर फ्रॉम द सर्विक्स टू फंडस। तो उधर जब उस वक्त कंसीव होने की चांसेस ज्यादा रहते हैं। जब अपानवात का काम होना शुरू होता है तो अनुलोमन करने की कोशिश करता है, तब फंडस टू सर्विक्स मूवमेंट ज्यादा रहता है, पेरिस्टाल्टिक मूवमेंट। उस वक्त आप कोशिश करने के लिए बोलोगे तो कंसीव हो नहीं पाएंगे। ये छोटी छोटी चीजें हैं। तो फिजियोलॉजी जब आप ज्यादा पढ़ते जाओगे तो आपका आयुर्वेदिक एप्लीकेशन बहुत अच्छी तरह से इंप्रूव हो जाएगा। तो ये सारी चीजें आपको पता चलेगा कि कब आपको क्यों, why you have to ask the patient to go for proper intercourse with more frequency in the mid of the cycle. So these are the very very crucial important things. Factors, there should be a proper ovulation. Dominant follicle देखना है, ovulation हो रहा है कि अच्छा नॉर्मल एग रिलीज हो रहा है कि 18 mm, 20 mm, 22 mm, 24 mm, तो एग अच्छा सा रिलीज होता है तो that is the best time for the intercourse for the natural conception. फेलोपियन ट्यूब्स अच्छा है कि नहीं, ट्यूबल फैक्टर्स अगर ब्लॉकेजेस है तो वो भी देखना है। तो स्पर्मेटोजोआ शुड फर्टिलाइज द oocyte at the ampulla of the tube. So अगर ट्यूब में ब्लॉकेजेस है वो फीमेल पार्टनर को चिकित्सा करना चाहिए, फीमेल का इनफर्टिलिटी। दैट इज नॉट आवर डोमेन टुडे, सो विल फोकस ऑन आवर मेल इनफर्टिलिटी। सो embryo should reach to the uterine cavity for 3 to 4 days. So these are the fertilization points. So endometrial receptivity should be there. So to improve the endometrial receptivity, you have to go for the functions of rasa, dhatu, oja, shukra along with artava, because all these four are regulated by samanavata. So conception happens on depends on the fertility potential of both male and female, along with the male is directly responsible for 30 to